Okay, thank you. Secondly, I've got 3 questions for the Minister of Justice, please. As far as stage 3 is concerned, will we then be allowed to start spreading fake news again about the virus and about government's efforts to curb and contain the further spread of the pandemic? Please talk to us about criminal records. So if you either, in your own wisdom, as you put it, admit that you were wrong and issued that fine, do you have a criminal record like Mr. Samupwa? Or if you get charged and you get tried and eventually convicted, will you then also have a criminal record? As far as the number of passengers is concerned in vehicles, how will that work during stage 3? And then a question for the Minister of Finance. Do we have an indication, Honourable Minister, how much money and income we have lost in excise duties over the last close to 80 days? Finally, to the Minister of Health and Social Services, Dr. Shangula, do we have an indication about case 1 and 2, the Romanians? How are they doing? And do we have a medical indication about the circumstances under which they seem to not recover? Thank you.
Before I allow others to talk, let me answer him. Firstly, I want to really acknowledge your hard work. I'm seeing you on TV, you ask good questions, you follow up, you really are hardworking. Now, I'm not wearing the mask here because, look, whom do I endanger? Common sense.
Okay. Your Excellency, with respect, it's not about common sense. According to the Minister of Justice, these are not mutually exclusive regulations.
No debate, I'm not in the Parliament. Yeah.
Very well. Please touch on it too, Honourable Minister of Justice.
I'm not sure what was the issue about the Minister of Justice in that last part, but just the other issues. I want to start off by talking to the question of fake news. The text of the regulations as they stand at the moment will not change in respect of fake news. So if you have intentionally and without having taken reasonable steps to establish whether or not the information that you're sharing with members of the public that relates to COVID-19, whether it is the illness of a particular person or information that pertains to COVID-19 that is likely to be damaging to either the efforts of government to contain the further spread of the virus, you will be held liable for fake news. And you would know that we have the text in the regulation makes it very clear that there will be certain elements that you would have, that the state will have to meet to find someone guilty of having violated that particular part of the regulation. And then in respect of the criminal record, I must indicate at this stage, if the idea really is that if you would have gone to court and you were found guilty, you would have had a criminal record. So I can indicate that. And then also, Denver, I was unsure what the other part of your question was. Do you mind repeating it? Because I don't think I...
Apologies, I don't want to steal my colleague's time. It relates to the number of passengers in vehicles. Thanks.
We haven't changed. You'd remember that we are still having a moderate approach to the opening up. So, for example, it is very deliberate that we've moved from 10 to 50 as opposed to 100 or more. And the restrictions, the vehicle space has not increased, so I don't think that will change. That's also a directive that comes from the relevant ministry. So if you are in a 5-seater sedan, the expectation is that the people in that vehicle will be 4, including the driver of the vehicle. And also, there's been a question about whether or not we should have, whether people should wear a mask if they're in the vehicle. If you are not with members of your family, everybody in that vehicle is expected to wear a mask. I do just want to also say, a question that keeps coming back is that the fact that we've locked down Walvis Bay, it means the restriction is no one can go into Walvis Bay and no one can get out. That is the meaning of it. There's been a lot of questions whether or not people, if people are commuting, the only exception is you can commute between Walvis Bay and Swakopmund if you are essential service and you have a permit for that purpose. Thank you very much.
Next. Oh, okay. You help me, huh?
Yes.
Yeah.
Thank you very much, Denver. You asked about case number 1 and 2. Case number 1 and 2, they are well. They have no clinical symptom whatsoever. They are in a satisfactory condition, both of them. Case number 1, it is rather an interesting, unique case because case number 1 has tested negative on 4 separate occasions. There was one time when also case number 1 was cleared, but immediately thereafter tested positive. After that, tested negative again. So we are waiting for the final test to see how it's going to come out. But they are all in a very excellent physical conditions. Thank you.
First, congratulations.
Thank you, Excellency.
Maiden speech. They interrupted you.
Thank you, Excellency. I thought today Denver was going to let me off the hook, but it looks like that's not going to happen. Denver, you were at Parliament yesterday, and you have heard me speaking about imports, and the excise duty comes from imports. And what I said yesterday in the budget speech is that because of the negative effect of COVID-19 on the entire region, in fact globally, but our region is also affected, the Saku region is also affected. Our imports are falling, and of course, when imports are falling, excise duty comes from, so custom duty comes from imports. Of course, excise comes from things like what we call the sin tax. When you drink a lot of beer, that the government is also collecting tax. Now, all these activities have been constrained because of COVID-19, and therefore, what we are seeing is that the revenue streaming in from this source is quite constrained. But with regard to the excise and customs revenue, for this year, as I have indicated yesterday, is that for this year, that started last year. So the money that we are getting this year, the fear is next year, because the impact of COVID-19 now, we are going to next year's revenue, and we may even have to first probably get less revenue from customs and excise duties, and we may also have to pay back into the pool because we may have used some of the money that we ought to have collected next. That will be negatively affected. So that's, I think, so it's not only on customs and excise revenue, revenue being constrained. So I hope I have answered your questions there.
Well, another hardworking gentleman, so keep it up.
Good afternoon. Your Excellency, I would like to mention this. I find your attitude towards the wearing of a mask very problematic, because when the SWAPO party had its party, despite the regulations, Namibians said, well, we're taking the cue from our leaders. So we are here live now. Everybody is seeing the father in the Namibian house is not wearing a mask. So imagine if the police comes to someone and say, please wear your mask. Someone may say, but the president is not wearing his mask. So
they don't use common sense.
How are we going to deal with this?
Use your common sense. Who do I affect you?
But common sense does not exist all the time.
Please ask the question.
Anyways. So I would like to ask, I don't know who, maybe the Prime Minister, I do not see the Education Ministry here. So there's this question. Namibia closed schools when we had only 3 cases. And now when we're in the heart of a crisis, a health crisis, we have decided to go back to schools and to reopen schools. I know the Minister of Education at some point said, we are doing this because it's a global trend, but we cannot be following global trends at a time like this. There is a public health crisis. We should put solutions in place that works for the country. So I would like to know, are we going to reconsider the going back to school, the reopening of school, given the latest developments? I also would like to know, given the latest developments, are parents allowed to keep their children at home and continue with e-learning if they do not feel safe or comfortable sending these children into the schools? I would also like to know, will our breweries and wine farms be allowed to export at this time? And will Namibia also be allowed to import spirits and alcohol? Dr. Shangula, I would like to find out about the quarantine facilities and the standards of testing. There's been a lot of outcry over the conditions of quarantine facilities. We can't hear. There's been a lot of outcry over the quality of quarantine facilities. And we also have the issue of people escaping or running away from these facilities. Is the ministry looking into putting securities at these facilities? I also would like to know, we have at this point 3,200 people that were tested. That's the latest figure, maybe it's 2,000, but yeah, anyway, it's not more than 3,000 definitely. We have, all these people are 1,700 people that are in quarantine. I would like a breakdown of the people that were tested. Who exactly are the people that were tested? Because I'm a little worried. From your statement yesterday, when you updated us about the case number 22, there seemed to be, it looks as if people are not tested upon arrival. And it looks as if not everybody is tested, even if they are in quarantine. So I would like to know whether everybody are tested when they leave quarantine. How many times are they tested in quarantine? And yeah, thank you so much.
Who's going to take? Who's going to take the Prime Minister and say something?
Yes, thank you. Good afternoon. I recognize the President, of course, the Vice President, the Deputy Prime Minister, and the other colleagues from the Cabinet. The questions about reopening of schools, the decision to reopen trend. At the time that we had closed schools, there were countries where schools had opened, and those countries were actually having more positive cases of COVID, and they even had a number of deaths, significant numbers of COVID-related deaths. We had our schools closed. We had specific targets for relaxing the restrictions, and that was mainly to say that if we don't have local transmissions, and we see that the transmissions from people coming into the country is low or at least non-existent, then we would relax some of the restrictions, and that is how we came to the decision to open up schools. I must also indicate that initially we had anticipated to open face-to-face teaching and learning only on the 3rd of August, but it was on account of recommendations from stakeholders in the education sector, the recommendations they were making to government, that we eventually decided to bring forward the date for face-to-face teaching and learning at school to the date that we now have. Obviously, given what has happened in Warfish Bay and the announcements that were made, it would mean that if Warfish Bay Local Authority area is to go back to stage 1, face-to-face learning cannot take place in Warfish Bay because they revert back to that situation of a lockdown situation. At this point in time, the position is that for the rest of the country, face-to-face learning would start. but this will be phased in, as was indicated there. Different levels of grades would open in a sequenced kind of manner, first and foremost to ensure that we are able to maintain social distancing and we are otherwise prepared to actually open the schools. That is on schooling. I think there was another question, whether the export of alcohol would continue. Yes, we indicated already under stage 2 that whereas the import of alcohol and consumption of alcohol was not allowed, the export was not disallowed. So if there is a country out there that had not banned the consumption of alcohol and they wanted to import from Namibia, it was allowed that our breweries should be able to export, because the rationale for limiting alcohol was about safety and health in Namibia, not to regulate the consumption of alcohol around the world. Now that we are migrating to the next level, which is level 3, in those parts of the country where we are migrating to the next level, the consumption of alcohol would resume subject to those restrictions that were announced. I think I have covered the question, if I'm not mistaken.
Next. Was there anybody else to answer more questions, clarifications? Yes?
Thank you, Your Excellency. There's a question that keeps coming back about what is the meaning of immediate effect for Walvis Bay. When we think about lockdown and stage 1, we would have remembered that the factories, for example, and other critical or essential services continued to operate. That condition or situation remains as is. The only things that will change, perhaps for better clarification, is the fact that we are expecting people to work from home unless they are essential services. We are expecting people to stay home most of the time unless they are going to the shop to do some shopping. We are expecting, for example, the requirement of public gatherings as it was in stage 1 to apply in Walvis Bay. So, and then also if you're doing essential services and you are, for example, working in Swakopmund, the expectation would be that you would apply for a permit and you would have to show proof that you are doing essential services in Swakopmund, for example. So those restrictions or limitations that were applicable under stage 1 are now applicable in the situation in Walvis Bay. And it is effective immediately. The thing about immediate, Your Excellency, really was to ensure that people don't panic travel now and try to move out of Walvis Bay if we had prolonged it to the time that stage 2 ends. So the issue of immediate was very deliberate. So factories, for those who are asking about factories, the factories would continue to operate under the conditions that they were operating under stage 1. Thank you very much.
Thank you. Next, any other question? Yes?
There was another question that I omitted to respond to. It was as to whether those parents who would prefer to not send their children to school were going to be able to keep their children out of school. Although the Constitution makes primary education to be free and compulsory, in a situation where a person has genuine concerns about the concern of their child, we would not be having police arresting parents who are not sending their children to school, but we give our assurance that we have done our best to make sure that the school premises are safe for the children to attend to learning, and that it will be in the best interest to go to school. But if they decide otherwise and they have other means of coping, that is up to them.
This debate is common. Even in America, I heard people talking about that. So it's a choice of parents. Next. Is there a question?
Yeah, there was a question on the quarantine. Yeah, we have what we call government-accredited quarantine facilities throughout the country, where all the arrivals, before they are released to their residences, they are put in quarantine to be observed for a period of 14 days. The arrivals, they will then be screened at the point of entry and put in quarantine. They receive, while in quarantine, they receive different kind of services, including psychosocial support. And then normally on day 12, they will be tested. And if they are tested negative, then they are released and discharged to go home. If somebody tests positive, then will be transferred to our treatment facilities. So that is the arrangement which we have. The last 5 cases, 5 positive cases, they were detected from the quarantine facilities through the procedure I have just described. Now, as we move on, we learn new things, and we also adjust our strategies. Currently, what we are going to do now is that upon arrival, the person will not only be screened, but will also be tested. And on arrival, if a person tests positive, will be immediately transferred to the treatment facility and will not go to the quarantine facilities. And those who test negative, they will be transferred to the quarantine facilities for a period of 14 days. And before discharge, they will be tested again. So that is the arrangement. Now, there has been a little bit of misunderstanding of the different type of quarantines with relate to the truck drivers. We are made to understand that at the truck port, there are quarantine facilities, but these are not facilities which meet our standard of a quarantine. Therefore, there has been now a change in an approach that instead of truck drivers being placed at the truck port where they are out of our supervision, they will be immediately put into our quarantine facility for observation according to our protocol.
Okay, let's move on.
Good afternoon. I'm Shaligan Peterson from Eagle FM. This question might be for the President or the Health Minister. Is Dr. Bernard Haufiku still the focal person on COVID-19 in Namibia? We haven't been seeing him a lot. How much has been collected through the special fund? And how much is the seed capital? And what has been done with that money? And I also want to see clarity with the Justice Minister. If you pay the fine, do you have a criminal record or not? I just want clarity there. President, you also said that the fine was paid. Who exactly paid the fine? And then also for the Justice Minister, is the regulation of wearing a mask mandatory or when you endanger someone? And then lastly for the Health Minister, the anti-malaria drug hydroxychloroquine, do you use it to treat our patients if you need it? Thank you.
Who is going to start?
Can I maybe ask that she repeats the question about the account? What account were you asking about?
The special fund that was essentially...
the COVID account?
Yes.
Oh.
Thank you.
Okay. Yes, maybe I can answer that one. The level of capitalization, the cash that we got into the account amounted to just over 34 million. And of which about 24 was cash that came from government itself, availed to COVID-related activities that are not of a health nature, because there was a budget for the Ministry of Health to deal with COVID. There has also been a budget to the Ministry of Education to deal with COVID, in the stimulus package that was spoken about by the Minister of Finance. Now, out of that account, Cabinet has agreed to an allocation amounting to about 16 million to be allocated to non-health related COVID responses in the regions. There may also be an additional amount that would be allocated from the account to support the budget to education, to enable them to be ready for the reopening of schools. So the amount was quite small. We did not rely on that really to deal with COVID. We relied on our own resources. The bulk of the support that we got from donors, be it local or international, came in kind. So there were donations of medical supplies that were made directly to the Ministry of Health, and there were also humanitarian relief products that were sometimes given directly to regional authorities or even to beneficiary communities.
Yeah, before you answer, Nikali, distancing is always being emphasized. I have distanced myself. Yeah, can you answer? I don't have any people in front of me.
If you pay an admission of guilt, you will have a criminal record. Just also, I want to just clarify that the issue of Walvis Bay is in lockdown. If you had an essential service or critical service permit, that permit is valid for purposes of going forward. So if you must be able to move outside of Walvis Bay to Swakopmund if you are essential service, or if so that's really truck drivers, people who work in factories, people who work in different parts of Swakopmund, but who have been listed as critical services under the first regulation that we had of the state of emergency. So just remember, stage 1 means the lockdown regulations would then be applicable to Walvis Bay. You cannot leave Walvis Bay as we speak because it is now effectively in lockdown.
Who's next?
Okay. I have two questions here. One related to anti-malaria. Is it from the same person? Do we use anti-malaria drug hydrochloroquine to treat our COVID-19 patients? And is Dr. Bernard still the focal person on COVID-19 in Namibia? Okay, let me start with the first one. We have gone through different stages in our management of malaria. And as you know that there has been an increase resistant to the traditional or conventional treatment regimen for malaria. And currently we are using a different combination, which is artemether lumefantrine for our malaria case as a first-line drug of choice. We do not use hydroxychloroquine for the treatment of malaria. And we do not also use it for the treatment of COVID positive patients. Dr. Haufiku, as you know, is appointed as a special advisor on health matter in the office of the Vice President. He participates, he's a team member of our team which deals with COVID-19, the team which I'm heading and of which I'm the spokesperson. Thank you.
Next.
Excellencies, my name is Blanche from NBC. I just have few follow-up questions to Minister of Health, and perhaps the other ones can be answered by the Minister of Finance or the ICT Minister. Minister of Health, Dr. Shangula, escaping from quarantine facilities seem to be, I don't want to say the trend, but it's becoming problematic now. But if we are to look at the areas to which these people escape to, isn't there a need to declare them as hotspots in the case of the last two truck drivers escaping, one to go visit his girlfriend in Havana and the other one going home to Korean. Now, Minister, these are areas where community transmission can be just like that, fast. So the enforcement part when it comes to escaping from quarantine facilities, that's just some clarity that I need from you. And then to Minister of ICT or the Minister of Finance, a lot of big businesses have indicated that because of the bureaucracy in terms of accessing the stimulus packages announced by government, they have to realign their business models and stay afloat, but then that will still include retrenchments. So any talks with the business community to avert the said retrenchments? I thank you.
Before you answer that, could I also ask to add to her question? Business people, big business people, don't they have reserves in their... How can a big business just say, because I didn't have the stimulus, what's it called, I'm going to lay people off? Big business have reserve. So could you please help me with that too? Yeah, can you answer quick? Who's starting?
Thank you very much, Blanche. The incidents which you are referring to in Windhoek, which happened in Windhoek, it did not happen within our quarantine facilities. As I have explained, the issue related to the truck drivers. So these truck driver concerned, they were not in our care when they left the truck ports and went into the other places. Currently now, when we became aware of that, we are making contact tracing. So everybody who has been in a contact will become a contact person. And obviously we assess the risk of transmission, and then the appropriate steps are taken. Either if it warrants that person to be quarantined, a person who has been visited as a contact also to be quarantined, so that we ring fence all the possible contacts that the transmission does not occur into the community. Thank you.
Mm-hmm. Minister.
Branch, you are probably referring to the wage subsidy, which has been rolled out by government to help businesses and employees that are severely affected by the effect of COVID-19. Yeah, that subsidy program was rolled out on the 10th of April this year, and it's targeting specific sectors that are severely affected when it comes to businesses. It's targeting tourism, as we know that since February this year, there has not been any arrival of any tourist into Namibia, and therefore the tourism sector is severely affected. The aviation sector equally so. And also construction was also affected especially by the lockdown restrictions. There were no construction activities. We felt those are the sectors that are severely affected, and therefore the subsidies at the beginning should go to those sectors. You are saying that there are those who are complaining that because of the bureaucracy, maybe legitimate concerns. So far we have, because this subsidy is being administered by the Social Security Commission, and we understand that more than 1,200 people or 200 employers or companies or businesses have already submitted their applications that are being processed by the Social Security Commission. So I think there's a lot of uptake when it comes to this subsidy. And if there are businesses that are not able to access this subsidy, they should let us know, or they should let the Social Security Commission as an implementing agency for this purpose. So that's part of one component of the subsidy. The other component of the subsidy targets all employees who have lost some sort of livelihood. If you were formerly employed, you have lost your livelihood, either you have lost your job or your salary has been reduced, you are also eligible to apply to Social Security to get some sort of subsidy. And this subsidy will help you to give you at least half of your income, but only those who are earning less than 50,000 Namibian dollar, those who are below the tax threshold. Because if you are above the tax threshold, there are other means, because we have made provisions for you can borrow and government will give you a guarantee, especially if you pay tax, because it's only for good citizens, and good citizens are those who pay tax, and therefore government will help you because you are good citizens. Those who are not good citizens, government will not be able to help you in this respect, because government gets its resources and revenue from tax, and if you are not paying tax, you shouldn't qualify and you shouldn't benefit from such a scheme. But other businesses, like the President said, we do not expect big businesses to retrench people. We expect them to make use of their reserves. Of course, these are difficult times. There may be others, there may be businesses who are struggling, but our appeal is really try and make use of some of these benefits that are being extended to business, like tax-backed loan schemes that they can get from commercial banks on the back of government guarantees. These are put in place to help cushion the impact of COVID-19 on the businesses that are not directly benefiting from the wage subsidy. I thank you.
Now we are coming to an end. I would like to thank the Vice President, the Prime Minister, Deputy Prime Minister, the ministers, the press people. It's my colleague there, very hardworking. I watch you every day on this very transparent way of answering to the sovereigns. I'm told it's unique that we had two sessions, one in the morning, 10 o'clock, and 4 o'clock, where people lucky enough from all walks of life could ask questions politely and got answers. Really, you are hardworking, very hardworking. All of you, that's why you are sitting here, but you are really the newspaper person, you are claiming, but you are with NBC, asking good, penetrating, follow-up questions politely. So thank you very much. All the gentlemen there under NBC and others, thank you very much. You are the ones who are also keeping the population know what is going on through this kind of interactions and daily actions I'm watching on TV. Although you don't see me, I'm seeing you every day. And I think while we may be disappointed as Namibians, as people who like to demand, rightly so, the world is looking at us. I'm getting letters, newspaper articles written, say, follow Namibia as example. Of course, outsiders do not know what is happening here, as you will say. But it's very interesting that the world is watching us. It is true, we don't know where we're going to end up now with the new breakout, which is starting now. But I would like to thank all Namibians because the world is seeing what we are doing. So because of that, thank you. And next briefing will be next time. Thank you very much.